All right, we're back to recording. So the answer to this question, of course, has to be very personalized. All right. I'm gonna give you a bad answer for telling you about yourself, and then I'm gonna go ahead with a good answer. All right. So a bad answer. So hey doc, tell me a little bit about yourself. All right. Well, I am from Islamabad Medical College. I did some clinical rotations and some research, mainly in medicine. But that's why I really like internal medicine because I think it is very interesting. Otherwise, I enjoy reading and spending time with my friends in my free time. I think that's about it. But I think most of the things are covered in my CV. All right. So, what do you guys think? Was this good? Yes or no? Probably not, right? So why? It's too vague. It lacks depth, right? It doesn't have any specific examples. Doesn't have a real structure to it. And this is the question that you can really, Khwaja says no. Yeah, exactly. This is a question that you can really shine on. And if you have some strong points in your CV, your excellent clinical experience, your excellent research experience, your some extracurricular activities that you're really good at, or you have an NGO that you work with or something that you can really shine on and bring out the different characters that you bring to the table, right? And they're looking for somebody who is relatable, who they can be stuck in an elevator for 30 minutes and you can have a good conversation with them, right? So I'll give you an attempt to give you an example of a good answer. Hey doc, so can you tell me a little bit about yourself? Well, thank you, Dr. Thank you, Dr. Smith. Thank you for this opportunity to introduce myself. I'm a recent graduate from Ilham Iqbal Medical College. And during my medical school, I developed a strong interest for internal medicine, particularly because of the diversity of cases and the opportunity to build long-term relationships with my patients. One of my most favorite experiences was during my internal medicine rotation, where I managed a complex case of diabetic ketoacidosis. I worked closely with the attending physician to stabilize the patient, which reinforced my passion for critical thinking and collaborative care. Not only was this patient having a significant and uncontrolled diabetes, the patient was also a heart disease patient, as well as the patient was on dialysis. So I do believe that these type of patients are a bread and butter for internal medicine. However, this early on really led me to enjoy internal medicine from their point on. Beyond academics, I have been involved in research focused on improving diabetes management in the underserved populations in my town. And this project not only deepened my interest in endocrinology, but also taught me how impactful evidence-based medicine can be applied in real world clinical settings. In my free time, I do like to mention that I do enjoy running and volunteering at a local health clinic back home, and where I like to connect with the community and contribute to public health. I do believe that combining a combination of my clinical experiences, research background, and a commitment to patient care will help me contribute meaningfully to a residency program over here. And thank you for giving me the opportunity to talk about myself. Thank you so much. Okay, how was this one? A little better, maybe. Okay, so the reason I think it's a little better, more structured, more focused, provided some examples, showed an aspect of teamwork, critical thinking, and also highlighted some of your extracurricular activities. You don't want this question to be only centered around your academics because they already have that. They already have their scores, your scores. They already have your MSPE. They already have your recommendation letters. But you should definitely home in on something that's really, really strong, as well as something that is outside of medicine. What else? What else do you like? You like volunteering? You like running? Anything else that you want to attach? So hopefully this gave you a bit of an idea that you should be composed and collected, and your answer should be a bit organized. Hopefully, I came around to you guys as approachable, calm, and yeah, hopefully. So hopefully this was a good response So we have a few questions. Why don't we tell about our personality? Not, yeah, you're right. So you can definitely add more things in there. You talk more about, for example, I used to talk about that. You of course know about my CV, but I definitely want to share some of my hobbies and interests. And I used to draw portfolios, and I actually said it in some of my interviews that I used to get bored in the lecture theaters and used to draw the teacher and make drawings of them during the lecture. So that was something, and I actually showed some of the my drawings. I had them on my phone. So yeah, show your personality, show your different side of your thing. I also used to make structures and ships and houses from toothpicks. So I showed them some of those pictures. So in a way, you could lead. You can show that you're a different person. You have a different personality. Um, Back in the day, Dr. Saad Bashir Malik, he had a mind program. I'm not sure if that's still active right now, but we used to go out in the periphery, in the Burewala and other places, and see how behavioral patients and psychiatric patients are being tied up um, around trees and everything else. So, any experiences like that? You say that I've done these things. Of course, you need to have you need to have actually done these things, right? It's not that you make things up. So don't make anything up because you won't be able to talk about it in detail. So whatever you say, make sure you have done it. And all of us, we've had so many experiences. So it should not be a problem to pick out specific aspects. And you already went through your personal statements and everything else. So you already have, really homed in what all that you've been doing in the past. Um, so exactly. All right, Varda, any thoughts?
No, I think it's a good answer, and I do agree with showing your personality more in the answer. So, yes, that's definitely appreciated because they want to know you as a person. They already know about the medical college and everything else from your CV. So, they want to know which kind of person you are, like your personality. So, I agree with the comments some of the colleagues made over there.
All right, great. All right. So Khawaja Muhyiddin, can we start with something like, hey, good morning. My name is, you can call me as Moin. Um, I was born and raised in Lahore, Pakistan. Okay, yeah, you can have a quick bit of introduction. It's you just structure it out. So Musa Kiani, I would have focused on myself, upbringing, adversities in life. Yeah, you can definitely mention things. Definitely mention things. That's not a yeah. Definitely add more to it. Maybe have a personal touch in there. But I think my main goal with this is for you to have a style of delivery. But you should be, since you have practiced, you would have practiced this much more than I just did right now. So you should be much more calm and relaxed, and come natural, very natural. This session is because over the years we've seen that the biggest issue that candidates face with their interviews is that um, they don't see, they need an example, and when you see a few examples, then you are largely in the driver's seat. Um, so yeah, so let me give you another question. Um, let's see. Let's go for an ethical question. All right. Um, so that ethical questions weren't that common like 15 years or earlier, but I think they're more common these days. Um, so ethical questions could be as if that you made a mistake and how did you handle that mistake, right? So ethical questions are very important. Um, so let's give you an answer about an ethical question. All right. So, for example, that you made a mistake, the interviewer will ask that, hey, if you made a mistake, uh, give me an example of a mistake that you made, and how will you be able to how did you handle that? How did you handle that mistake? What happened? Things like that. Okay. All right. So, all right. Well, that's a good question. And as medical professionals, we try to do our best. Yet we can always make mistakes or overlook things. And I do remember during one of my ICU rotations, I once made a mistake with the dosage of a medication. And I was actually responsible for double checking the dosage. But in the midst of my busy work, I missed that. And instead of giving amiodarone 200 milligrams twice a day, I ended up making it 400 milligrams twice a day, which you can realize is absolutely incorrect, and it should not be that the case. I did immediately inform the attending, and I also discussed with the nursing staff that we'll be careful moving forward. We closely monitor the patient for any adverse events, and fortunately, the patient did not experience any harm. Then I, of course, took the steps to understand how I made the mistake. I reviewed the incident, and I definitely realized the mistake was that I did not reconcile my medication when the patient actually came in. I should have gone through the medication list in more detail, and I should have sought secondary sources for the medication list, such as calling the pharmacy to make sure that the patient's list is accurate. So we identified this issue and we corrected this, and nothing untoward happened. And to prevent this in the future, to prevent these type of errors in the future, I implemented a personal checklist in my mind where I always make sure that the patient's medication is accurate, and I have a secondary source of double checking a patient's medication list. So this experience definitely taught me the importance of paying attention to detail, effective communication, and creating systems to prevent any errors. And this also reinforced my commitment to patient safety and continuous improvement. And I have not had any further issues with regards to medication management or similar details since then. Thank you. Thanks for asking this question. All right. So what do you think? The good things about it is you have to do is the do's and don'ts would be you have to acknowledge your mistake. You have to say, you can't say, oh no, I'm perfectly fine. Especially since a lot of people from Pakistan, we have already done our house job or started our MO-ship, right? So, or we've done, private jobs. So there has to be something that you can pinpoint and identify, right? And I would ideally suggest that don't bring out a mistake that led to somebody really getting hurt. That may sour the taste a little bit, right? So think about something that happened that was relatively minor, did not hurt the patient. And you don't want your interviewer to think that, okay, yeah, you killed a guy. Okay, so you don't want you don't you don't want you don't want to hurt somebody. You don't want them to think that, oh yeah, you hurt somebody. Yeah. Anyway, so acknowledge your mistake, take immediate action. All right, this is how you should structure and what you learned from it. And other thing is you should not hide it, right? If a mistake happens, and in the US, in Pakistan it may have been different, but in the US, if you make a mistake, then you let somebody know, hey, I picked up this mistake and I made this error, but I fixed this as such, and I've learned my lesson, but I want to let you know. So this develops trust. They will trust you more. They will think that yes, you are somebody who they can trust on, rely on, who would not throw them under the bus or hide things, and things come up later. All right. So hopefully this was give you an example. Okay, so do we mention that we apologized? So yeah, so the other thing is, do you apologize to the patient? It'll probably depend on the case. If it's a relatively minor thing, I would say, well, it depends on the case, right? If if it's a surgeon, you cut off the wrong vessel. Hey, I was at that vessel got cut, but we were able to fix it. Everything is fine now. But so it's going to be exactly. So you don't want to, at least in this answer, at least for this answer, let's forget about the real world circumstances. At least for this answer, you don't want to present a case where there was a huge consequence. You want to present a case where the consequence wasn't major or it was none at all, but you picked it up, you admitted your mistake, you relayed it to your attending or your team, and the problem was fixed. I don't think you should go into a real bad case. Don't do that. Okay. So bad cases end up happening, but don't talk about that in the interview, I think. All right. So, okay, same thing happened. Yeah, sometimes, medication issues are a big problem. Exactly. Can we redirect the question to how I help in preventing error by someone else? Yes, that is again another ethical question. So there are numerous ethical questions. You notice a colleague who's making a mistake. All right. So, but this is just to give you a framework. You will have questions like your attending is angry at something and making a mistake, or your attending is under the influence of drugs or alcohol. So all of these type of ethical questions do come in. So yeah, so all these ethical questions do come in. So don't, yeah. So can somebody make a screenshot? Varda, can you just make a screenshot of this so we can have this in perpetuity?
Yes.
All right, great. Okay. So, all right. So a couple of people have some comments. So no, if they ask you for Rabia Ansari, if they ask for your mistake, you'll talk about your mistake. Or if they ask about a question, hey, if you're attending, you see your attending is drunk, how will you deal with that? So that is another question. Okay, so that those type of questions happen, and ethical questions are there. So you need to have a framework of how you're going to be handling these questions. All right. All right. So let's jump on to some other questions, and yeah, share a few questions that you have in mind. Maybe we can look at a few things. But again, the idea of this whole thing is, so you get you see how it's supposed to be done and how you should prepare for it. So I think that is the main point of these things. One very important question is, why should a residency program choose you? Okay. Another question is, why should we choose you? So so let's talk about this. And this is again an answer that you should all have prepared. So I think that this is a type of question you should all have prepared without any beforehand, and be confident and be relaxed when you're presenting this answer. Okay, so let me look to give you a sample answer. All right, and then we'll get into some more questions and answers. Good question. I don't like to belittle any one of my my peers. However, I do feel that I'm a very strong candidate. A residency program should choose me because of my strong dedication to patient care. As you can see, my solid academic background and my hands-on clinical experience. And during my rotations, I consistently received positive feedback for my ability to connect with patients and my attention to detail in diagnosing and testing their conditions. Moreover, I have demonstrated leadership and teamwork skills through my involvement in various healthcare initiatives. For instance, I led a community health project that focused on improving diabetes management in the underserved populations. This taught me the importance of patient education and the impact of preventative care. Of course, I'm also committed to continuous learning and professional development. I have participated in several research projects, including a study on the effects of telemedicine on patient outcomes, which was, as you can see in my CV, was published in a peer-reviewed journal. So this research experience also has enhanced my analytical skills and my ability to apply evidence-based practices in clinical settings. And in addition to my clinical skills and my technical skills, I do bring compassionate. I do bring a compassionate and an empathetic approach to patient care. I believe in treating patients holistically, considering not only their physical health, but also their emotional and their psychological well-being. And additionally, I do believe that my ability to build rapport with my patients and provide them with comprehensive care will be an asset to this residency program. Overall, I believe that my combination of my clinical experience, research involvement, and commitment to patient-centered care does make me a strong candidate for this residency program. And I'm excited about the opportunity to learn from and contribute to your esteemed team of medical professionals here. Thank you. And any other questions, please do let me know. Okay. Okay. So yeah. So another example, right? Um, okay. So the question is aspirations from our program. Yeah. Very important question. Uh, Very important question, right? So where do you see yourself doing in the future? Let's say in the next 3 years or 5 years, a very common question. They may ask 3 years, 5 years, 10 years, 15 years. And they want to ask you this question. One is, have you studied their program? So yeah, before you actually, you are appearing for the interview, you need to study the program closely. What are they offering? Are they a community-based program? Are they a university, more of a university-based program? Do they have fellowships? Do they not have fellowships? If they have fellowships, what fellowships are they? Do those fellowships, do they go line with your future plans? Excuse me. Or if they don't have fellowships, but their candidates or their residents do match in fellowships, and they actually help their residents um, find fellowships outside of their program, and the program director or anybody else, they actively pick up the phone and call for on your behalf to get you fellowship interviews. Or what? Yeah, exactly. So you need to know about the program, and these type of questions help them understand whether you are actually a good fit for them, whether they will help you, and whether you will help them. Because if they're looking for people who are going to fellowships, if all of their people are going to fellowships, it means they want candidates who want to do a fellowship, right? If you see that in their program, none of them are doing fellowships down the line because they have more of a community-based setup and they want people to do outpatient medicine, well, then you cannot say that, hey, I'm a great candidate for this program, even though you guys don't have any fellowships and you don't want your people to go to fellowship. I want to go to fellowship. That's why I'm going to be part of this program. So they're not going to rank you, right? So you need to have your answer prepared. And during your day, your interview session day, and Varda can talk more about how her interview was when they had these online sessions, and and they do tell you about their program. They give you all the details, and this question also looks at whether you were listening, whether you took notes. Okay, so let's give you an answer. Let's give you this answer. Where do you see yourself in the future in the next, let's say, 3 to 5 years, right? All right, so okay. In the next 3 to 5 years, I see myself becoming number one, a highly competent and a compassionate physician wherever I am. And I will be looking to and dedicated to providing the best possible care to my patients. My immediate goal is to complete, of course, my residency program and gain valuable clinical experience, which I will carry forward for the rest of my life. But within these 3 years, I hope to be, within these 3 years, I hope to have my direction in the future, and I want to pursue my medicine further as a specialist. I do feel that within the first year, and I looked at your didactics, that we will be rotating in different specialties. And after the first year, I look to make my decision with regards to the different fellowships that are offered over here. I see you have a wide range of fellowship options, such as cardiology, endocrinology, as well as hem-onc. And I do believe all of these interest me. I am also fairly interested in critical care medicine, which you also have over here. So in the first year, I look to be focusing myself on deciding what I want to do in the future. And from that point on, I would be 100% focused. I will be building up my CV to go for my chosen specialty. And that's what I want to do. In the first year, I want to plan for which specialty I want to go into, and then on prepare forward for that particular fellowship. And looking ahead for 5 years, I envision myself also taking more of a leadership role within my own medical practice or a hospital. I'm also particularly interested in mentoring medical students and residents and sharing my experiences, and helping to shape the next generation of healthcare professionals. And additionally, I do have a little bit of research experience, and I would look to carry that forward, not just to obtain a fellowship program, but however, I look to continue this in the long term as well. And yeah, so I do feel that in the next year or so, I should have a clear idea in my mind which fellowship I want to be joining. And in the next 3 to 5 years, I hope to be attaining that fellowship and pursuing my career further. Overall, I'm committed to continuous learning and professional development, and I'm pretty sure that this program is in line with my goals and aspirations. Thank you for asking this question. Okay, so this is more about the aspirations, right? Varda, so can you give us a little bit of detail about what was your experience and how many of your interviews were with, how did they structure the interview in the day? Did you just pop in for the interview, or they had video sessions, they had training sessions, they had sessions describing more about the program? Can you give us a few examples of what was your experience?
Sure. Thank you, Dr. Omar. So the thing is, it really depends. Every program has their own structure for the interviews. And yes, almost all the programs will start by introducing their program. Like, what do they have in their program? What can they offer? Sometimes they do the presentations, and sometimes it's the panelist on the, interview, which give them about the overview of the program. Second thing is, whenever you have an interview, most of the information is available on their websites these days. So often those presentations are repetition of that thing, so you can already search about it. That's important. And now, like, regarding the interview, so often you will have interview with 3 or 4 people. It's not just one person. And sometimes they divide the interview parts. Like, for example, one person will focus on your academic things, one person will focus on your personality. And they also have, like, now that I'm part of the work, they have like little sheets where they score each candidate. So they calculate the total score, and based on that they make the rank list. So that's how they do it. And that, I don't think so there was any program I interviewed with just one person. There was often like 3 or 4 people who interview with you. So that's how it is. And one thing which will be important is to know about those people, just like you will, tell them about yourself. So, for example, these days on LinkedIn, and if like you have interview from a program, and let's say, like, Mark Smith is the program director, you go on the LinkedIn and you research about that person already. So when they ask you your questions, you ask them about themselves as well. That really like builds a connection with them. That helps. And of course, like, just like Dr. Khan mentioned, don't be robotic and those things. So they are there. Mostly it's like 3 4 people who interview you.
Okay,
Is,
yeah.
is there
So
anything specific that I should be mentioning, Dr. Khan?
no, I think that's good. So you had an interview where there's only one person, then there could be people who are interviewing you separately, 4 or 5 people separately, right? Not four or five,
Yes.
but 3 to 4 maximum, right?
Yes. Mostly, I don't remember any single interview in which there was just one person.
Hmm.
There are like 3 4 people. And yeah, and every like interview person, they have their own like personality as well. They all are different. Some people would sound so serious, some people will be very casual.
Yeah.
So you have to make sure that you are like reflecting yourself in a appropriate way.
No, exactly. I remember. I
Yeah.
mean, this, of course, I was much before this video interviews. Um, One interview was they were all the interviewers were like four of them were sitting, and there were three us candidates, and that was kill. So they were asking medical questions. Okay, now your turn. Now your turn. Now your turn. So
Yeah.
everyone was trying to one up the other person, and that was a little interesting and scary that four people were interviewing three other people, were interviewing three candidates at the same time.
Yeah.
Um, that was did that happen online?
My interviews.
No, no, anything like that happened?
So yeah, I had not like I wasn't like interviewed with different people. I never had that experience.
Right.
But I had one program where like three, four people were sitting in the on the same table and I was being interviewed. That's
Right.
like a panel interview. That was just one program. Otherwise, it's like one-on-one
Wow.
mostly. Even like that program has now switched to I ended up actually matching at that program,
Same.
but it's like, mostly it's like one-on-one. Now they even do one-on-one because that's more, but that can be a little intimidating as well. It's like you
Right.
are just there with them.
Right.
I
So
think there are some people who, some colleagues who are asking question how so we know beforehand who's interview. Yes, when you will they will schedule you for the interview, they will tell you the names and the timeline, like you have interviews with these people and this is the time, so that's how you will know beforehand. And it honestly takes just 10-15 minutes to search that person, whoever is interviewing you. And also, how do you call the panelist, like doctor, if the last name is tricky? Because yes, no, doctor is not fine. So I made this mistake, like, in one of my interviews, it's very important to call them by the right name, and the best way to know is to contact one of the resident in that program if you know already, and you should know how to pronounce that name. So that was a Chinese, program director, and his name was very like difficult, and I didn't even know how to pronounce that, and he actually had a different pronunciation. So yes, saying the right name is important, and we should like spend some time, at least the program director. So I would suggest not to call doctor, call them by the last name, but research beforehand. If you are like, for example, my last name is Hamid, so a lot of people will call me Hamid or Hamid, but if they are calling me by like, going by the right thing, that's acceptable because I understand some people just cannot say it. But if they just are saying something else, the person who's interviewing you, they will think like, oh, are you even interested in, this interview? It gives that impression.
question,
That's the reason.
Dr. Hamid, right? You are saying say Dr.
Yes.
Hamid,
Yes.
not Dr. Varda, right?
No, they don't go by first name. It's just the
Exactly.
last name.
So
Like, I
yeah,
think you go by Dr. Khan, right?
yeah, I try to hide myself, right?
Yeah.
Um, yeah, so Dr. Hamid. So you're gonna say the last name. And second, it's okay if you don't know how to pronounce your name, you ask them. They will, of course, hello, hi, how are you doing? They will mention their name. Hi, I'm Dr. This. Glad to have you on this call. They will probably mention their name. If they don't, say, hi, good to be here. I'm a doctor this. And can you and I was trying to see how would you ideally pronounce your name. Can you help me pronounce your name properly? Just ask that, and that's
Yes.
fine. They're okay. They know probably
Yeah.
20 other people messed up their name, but you have the courage to ask about their name. They will actually appreciate that.
Yeah. Or you can ask like, how would you like to be addressed? I would
And how
appreciate if you
exactly.
can let me know how would you like to be addressed. Plus now these days there are pronouns and all, but honestly, like elderly people, they will be mostly interviewing you. They are not much into it. And I haven't mentioned it here, but I remember during my interviews, I would mention she, her, or whatever pronouns you wanna go by. This thing is like important as well now.
Yeah, so I think just keep it simple. If they say this is what they are, then use that, right? If they say this is who they are, then just use that. But use Dr. Khan, Dr. Hamid, Dr. Smith, Dr. Patel, whatever. I think that's reasonable. But if you don't understand, what words did you use, Varta? That was actually exactly the what we should be using. How do you?
Like, yeah. And thank you for being here. I wanted to request, how would you like to be addressed?
Exactly right.
Yeah.
How would you like to be addressed? I think there was one question. I aspire to learn the healthcare quality aspects of the U.S. healthcare system. As in Pakistan, we don't have that. We don't have them, unfortunately. I wouldn't ask that. Uh, no, you're not here to learn the U.S. healthcare system. You're here. No, I know that was something even 20 years ago that we. Oh, I want to learn the U.S. healthcare system. No, I think that's probably not the right. Just don't say that. Do something else. Yeah, that's fine. Don't include that in your answer about your goals or aspirations or whatever. That's just a given. When you work in a system, you will learn it. Um, um, like also, how do you call the panelists? Like only doctor? No, yeah, we just talked about this doctor and the last name. Do we know beforehand? Yes, we know beforehand. So what Varda also mentioned was look them up. If they have a profile on their website, look them up. What are they? They're a program director. They're the associate program director. They are the what do you call it? Chief resident, or they are the head of endocrinology. They're the associate program director. What are they? Look at them. Have they done any research? What else is there in their profile? And maybe you can connect some of your answers with their experience, and that will be very important. That, oh yeah, this guy actually spent the time to see what I do. Okay. So that's going to be very important.
Yeah.
uh
We have another question. How long are the interviews per interview? Mostly like ranging from 5 to 20 minutes. It depends on the program. What things we should try to know about the doctors in panel? Like, what do they do? There's just like Dr. Khan has mentioned, their specialty. Honestly, just look at their LinkedIn profile or their, most of them do have LinkedIn profile because they are being hired by different things and all. You can just Google them up, know like their background, like what do they do and all. Even knowing that will benefit you because you will reflect a lot more confident because you will know who the second person is. Because I remember during my first interview, I had no idea who the next person is and I was so scared. So I wasn't able to, reflect myself properly either. So that will help you, in sounding good as well, apart from that.
right. Okay, so
And
one question I think I should talk about is, and it happens especially in community-based hospitals and in IMG friendly locations such as in New York, Chicago, or big cities where they are basically largely community based. And this is about, tell me about an interesting case that you have. So you should have at least 2 to 3 cases ready. I know we used to do that. Varda, are they still asking medical questions?
uh, mm, I don't
Not medical questions,
remember.
but present a case. This used to be a very common question.
Yes, I honestly don't remember. I had several interviews but I don't remember anybody asking me as such medical question. That's not even a thing because your step scores and everything has answered that thing already. But they do sometimes give you like a scenario or something. How would you act in
Yeah.
that scenario? I think somebody mentioned about how do I know attending is under influence. So like they can give you these kind of scenarios and how would you approach them. That's how they think. I don't remember. It's not even a trend like they ask you medical questions
Yeah,
anymore.
I remember there were scenario questions. They will give you a scenario and what would you do about it, right?
Yeah. Yep.
And interesting questions. We used to have 2, 3 questions prepared. And I'm just going to give you an example so that you are up to speed. And the reason they ask this question, especially community-based programs, is because you have put down in your CV that you have done your residency, yeah, how job की हुई है हमने, yeah, we have did 1 or 2 years, or we practice at this outpatient clinic, or we did this private job. So they want to know if you know how to present.
Yeah.
That's the basic point. If you did your house job, and you didn't learn how to present, then you're not used to them, right? So this is all about that, how you will present a case, right?
Yep.
And
How
so
will you present a case? How will you interact with the other people?
right, so I'm just gonna share one such case. And of course, in Pakistan, we end up having so many cases, whether you have been in your residency, house job, yeah, even before, because you rotate, right? So let's give you an example. You just need to know, go through the process of presenting a case, that you know how to deal with patients, right? And all of these type of questions will be like that if they give you a case or you present something. So, okay. So, all right. So, tell me about an interesting case that you have been involved with. Yes, I do recall an interesting case. And one of the most interesting cases I encountered during my internal medicine rotation involved an individual, a male individual in his 50s, who presented with significant abdominal pain, fever, and jaundice. His past medical history included diabetes type 2, hypertension, with no otherwise any significant surgical history. The patient reported that the pain had started gradually over the past few days, progressively worsened, most prominent in the right upper quadrant area. No significant radiation, around 7 by 10 in intensity, sharp and stabbing in nature. And this was also accompanied by nausea and vomiting along with the fever. He also mentioned reported generalized weakness and dark urine. He did deny any recent travel or sick contacts, but they did mention he did mention that they did have a recent family outing, where they ate outside. Their vitals included a temperature of 101.2, heart rate 110 beats per minute, blood pressure was around 130 by 80, respiratory rate 18, oxygen saturation was adequate, 98% on room air. Pertinent physical exam findings revealed scleral atrophy, a right upper quadrant tenderness on abdominal palpation, and a 1 centimeter hepatomegaly was identified. Laboratory findings included an elevated WBC count of 15 with eosinophilia. Liver function showed an elevated AST, ALT, and an ALK-phos, alkaline phosphatase, as well as bilirubin levels. Blood cultures were collected. We did obtain imaging. Initially, a CAT scan was done, which showed mild hepatic enlargement with diffuse parenchymal changes. Subsequently, a right upper quadrant ultrasound was obtained, which did show hepatomegaly, but there was no evidence of biliary obstruction or gallstones. And given the what happened initially, as we were exploring more hepatitis, viral hepatitis etiology. However, we conducted a acute viral hepatitis screen that turned out to be negative. And no family members were known to be significantly positive as well. And so we were sort of in a fix on how to diagnose this patient with worsening liver enzymes, and we were not controlling his symptoms. He was having recurrent fevers, and his bilirubin level was creeping up on a daily basis. So I actually had admitted the patient. I was part of the admitting team, and during my conversations with the patient on a daily basis, I remember that he did mention that they ate out. So I inquired a little further, what did they actually eat? Because normally in our area, you eat out, you will get a viral hepatitis. Hepatitis A could significantly present like this, um, which is very common in our part of the world. However, I asked a few more questions, and he mentioned that they were eating fish. And this expanded our differential to include parasites. And we conducted a serological test, and which showed liver flukes. And after that, we started the patient on antiparasitic medication, and the patient gradually improved. And over the course of the week, the patient ended up being discharged. We also then had confirmed that by a stool examination, and we confirmed liver fluke eggs. So this was a interesting case, which was not clearly evident early on. Although I do believe that if I had taken a bit more detailed history into the exact nature of the food, we may have picked this up a little earlier. But yeah, I found this case to be fairly interesting. Thanks for asking this question. All right, so so that's I think how we may approach this, right? You need to be able to present. And in Pakistan, you can have so many infectious diseases, right? POTS disease. You can have people with cancer coming in late, being treated by hakims and all that stuff, right? Um, um, so many things you can mention here. So yeah, the goal is to present a case, know how to present a case, stepwise manner. So that's I think how you should approach this, Varda.
Sorry, what was that? I'm trying to answer the
Oh,
questions in the panel.
okay, sure. What do you have?
Um, yeah, there were some questions, so I'm just like trying to answer them. Sorry, what was that, Dr. Khan?
Oh no, so yeah, I think they're looking to see how to present the case, how you are
Yeah,
able to bring your thoughts together, go in a stepwise manner, the basic history, review systems,
yes,
history of present illness,
yes,
vitals, pertinent physical exam findings, investigations, imaging, stepwise
yes.
manner,
So,
yeah.
yep, just like you were presenting that case, it was good. I think the best way to do it, you consider yourself that you're rounding, and how would you present the case that time? Because in virtual interviews, unfortunately, the time is very limited as well. So you should try to structure your answer like within 2 to 3 lines max. And like, for example, if anything which is normal or whatever, you don't have to like mention that. And try to structure your answer like in 2 to 3 lines, just like Dr. Khan, you mentioned about that patient, like including their past medical history, surgical history. And then I would mention, like, this is the outline of the case. What aspects would you like to more about this case? So it should be like back and forth answering, then you know going into the details just in one answer. that's
Yeah,
that's
yeah, they could, depends on the person, they may
Yes.
stop you. So yeah, that's a good point. You should know everything about the case. Pull up
Yeah.
the records, okay, if you can. So
Yeah.
pull up the records if you can,
Yeah.
and know each and everything about the case. And liver fluke, you need to know about, hey, what is it? What is this? Opus torqueus, something, right? So you need to know about it. Okay, so hey, tell me about the life cycle of the liver fluke eggs or something. So you need to know about that case, okay? You need to know everything about it.
Yes.
Don't, yeah. So exactly, you can't act like, okay, yeah, that's all I know.
Yeah.
So
And it's okay if they bring up some point or something and you don't know, say, oh, doctor, I don't know about this thing. Just be honest. Never make up stuff. Like, that's a red flag, making up stuff.
yeah, don't exactly. Somebody has a question. Is it going to be recorded? Yeah, it's going to be recorded, and it's going to be on the. I'm going to upload this on the YouTube channel, AIMCAANA YouTube channel, so you can rewatch this later.
Yeah.
Um. Okay.
And I also wanted to address one thing. Sorry, I'll just take few seconds. Some people mentioned making that mistake of doing 4 ml instead of 4 units, and they were ready with the dextrose and everything on the side. That's very proactive. But this is just a clinical point. So whenever that kind of mistake happens, give the dextrose already. It's okay for the sugars to go high, but it's really bad for the sugars to go low. So give them the dextrose and everything already if you have given them a lot of insulin, and keep checking their blood sugars every 15 minutes. So that's like the way to prevent a death, because I have seen in, like, our Jinnah hospital, people would literally die of hypoglycemia. So don't wait for the hypoglycemia to kick in. Give the dextrose and everything already. Sorry, it's just a side point, but it might can help somebody.
Yeah, don't kill with hypoglycemia. Exactly.
Yeah.
Do they ask about our U.S. clinical experience, like it was hands-on? Well, I mean, you probably mentioned that in your a CV. So normally observerships are not hands-on. Externships are hands-on, and those are done usually within med school. If you were able to rotate during your medical school, you applied for programs during your medical school. After medical school, all the insurance issues don't allow you to have hands-on experience. Very rare that you will have a hands-on US clinical experience. But you can say that I've had extensive hands-on experience and I'm well versed with physical exams of all systems, neurology, cardiology. I'm well versed with this. EMR, you can say if you haven't had EMR experience, then say you don't have experience. If some private place in Pakistan do have EMRs, and you can mention that. What was the capability of the EMR? So you have a general idea about what you want to mention. What was the capability of the EMR? If you have not had experience, say you haven't had a first-hand experience, say whatever is your situation. Don't lie about it.
Yes.
uh,
Okay. I
so
want to mention another thing regarding the interviews, just like we went through all the answers which Dr. Khan did. Again, like keep the sticky notes around you ready, because they will ask you like about this, just like the case. You should have like a well structured case, like your strengths, weaknesses, the common, like 10-15 questions. Like write them on the sticky note in the way you understand and have them ready there, because sometimes what happens when we are in that performance scenario right now, we know we are comfortable, we know that we are not being judged, so we remember everything and we do it. So that you don't freak out. So during the interview, like a lot of people do that, and it's not as such like cheating or anything like that. So keep the sticky notes ready. So for example, if they ask you, just quickly, you have it. You don't have to really look at it, but you have it there. It helps some people. I'm not sure everyone is different.
right, right. Okay. No, exactly. Um, okay. What's questions? Lots of questions. I think I may miss a few things. Um, most commonly based. Okay, so, Nasser Hamid is writing most community-based hospital ask interesting clinical scenario, especially where faculty are from India, Pakistan, Nepal. I've had a faculty from in the Caribbean who asked for, yeah, anybody who's from a developing country. They will they may ask you. They're more likely to ask you. American people may not ask you, who were trained here. Um,
Yeah.
um, they will not ask that much. Varda, can you look at the few other questions you want to address that they have?
Yeah, I think I have addressed most of the questions, and we have gone through how they also check. Yes, so I think Dr. Hamid is trying to mention why they ask these questions. Yes, he's right. So they actually want to see your skills instead of, whatever you did. They check that you're able to justify. Yep, that is true. And then Dr. Ansari had this question: can we redirect question on how I helped in preventing answer error by someone else in the team? It's better to keep these kind of things personalized than uh,
So
involving some other
the
person.
question will be straight. Uh,
Yeah,
Tell me about a mistake that you made, okay? Or tell me if you identified a mistake somebody else made, what did you do? Or tell me if your
yeah,
attending is making a mistake, what would you do? Or
yeah.
tell me if your attending is under an influence, or tell me if your colleague is under the influence. Okay, so that
Yes.
question will be very specific, but the framework will be the same.
Yep.
The framework, no, yeah, the framework will be the same. Um, okay, I think we're reaching an hour. So
Yes.
I think you probably have a reasonable idea what to do, what type of answers you should look to prepare. I mean, this is my opinion and Varda's opinion, right? But you could ask other people and get their opinion on these things. So we're looking to have another session, and in that session, we would want you guys to be prepared with a few questions and answers. Okay, so we will look to have breakout rooms. That's going to be either on the 5th or the 6th. That's either going to be on the 5th or the 6th. And we're going to have breakout rooms where um, one of us, there will be more people hopefully, and you will present your answers, and that's the best way to prepare and learn. If you can find a partner to prepare your questions and answers with, do that as well, so that you have some accountability. All right, sounds good. Nasir, you want to jump on? If you're listening. Where's Nasir? Um, hey, Assalamu alaikum, Nasir. Dr. Hamid, he's a very important person in this whole endeavor.
I see.
You hear me now?
Yes, yes, we can hear you.
Yes, Dr. Khan. I was also trying to learn something from your experience and from Dr. Verda. Yeah, that was a great, session. Yeah, the last question you mentioned, it's very pertinent because that question was asked from me during my residency interview. That did you ever commit a mistake, and what did you do to rectify, or to resolve the issue if something happened after your mistake? So honestly, actually, it came to my mind all of a sudden. I made on that spot, so you really have to be prepared for all that. So, questions they're gonna ask you. They just want to see actually how good you are, how truthful you are, how honest you are, and if you commit a mistake, do you have any plans to resolve the conflicts if created by all your mistakes? So that's a very pertinent question. So I just wanted to add in your discussion.
Right. Okay. All right. All right, sounds good. Any other questions? Varda, anything else coming up?
No, I think we went. There's honestly like tons of material about interview preparation, which is available online as well. But I think we tried to touch whatever was possible for us in this session.
Right. Let me just go through. No. Okay. This last question. I don't want to answer that question. Was that anyway? Actually, with this, yeah, just watch this video. Watch the video recording again just to have an idea. If you feel like it, share with other people. It's going to be on the AIMCAANA website. Yeah. So, yeah, just type in residency and you'll residency interview questions, and you'll probably get some videos on YouTube. Um, I won't say which channel, but I do some videos on YouTube as well. So I don't know, but I don't want to give my channel because that's going to be a conflict of interest. So yeah, that's fine. Yeah, wait for the next either the 5th or the 6th, and we'll have an announcement, and we'll listen to your answers. All right. All right. Thank you so much. Thank you, Dr. Nasser. Thank you, Dr. Hamid. Thank you so much.